Every day in healthcare, codes are assigned to conditions. Conditions like depression, high blood pressure, dementia. In the United States, we use more than 70,000 unique alphanumeric codes to name a problem. You might have type 2 diabetes, but the system names that E11. And the names don't just describe what's going on, they actually act as a key that opens the door to treatments, standards of care, quality measurement, and reimbursement. But there's one condition affecting hundreds of millions of people worldwide today that's treated as a life circumstance. Now, having a life circumstance code is like standing at a locked door with the wrong key. There's no access to treatments or standards of care. Life circumstance codes don't drive quality measures, and they don't trigger any reimbursement at all. It's estimated that 1 in 4 of you, that's 250 of the 1,000 of you here today, already have this condition, even if you haven't claimed it. That condition is caregiving. Now, I've served as a nurse for over 35 years, 17 in direct clinical practice, over 20 in healthcare tech, and I have something to confess to you. I spent the majority of that time focused on the patient. Now, sure, at the time of discharge, I would meet with the family and, go over a dressing change, medication schedule, things to look out for. But I really just wanted to know, could they do that task? I never really stopped to think about if they could thrive in the role of caregiver. I was more focused on the care receiver. I should have been equally focused on the caregiver. Let me tell you about David. In my father's home, there's an iconic photograph, 2 couples arm in arm at the beach. My dad, Marvin, is wearing a bright yellow baseball cap, advertising his tax business. He has his arm around my wicked, awesome stepmother, Nancy. And they're with their 2 best friends, David and Joyce. Although they lived 90 minutes apart, they were always together. This foursome could turn weekend visits into weeks. Now, in September of 2021, Joyce began having noticeable word-finding difficulties. Through workup, she was diagnosed with dementia. Her decline was rapid. David became her sole caretaker. No help in the house, no help in the bathroom, no respite, no guidance. He was grieving, exhausted, and increasingly alone. But no one in the healthcare system noticed David because we don't systematically track caregiving. In June of 2022, David sat down for a nap in his chair. He never woke up. Joyce, in her confusion, went to a neighbor. 911 was called, and my stepmother, Nancy, already a full-time caregiver for my father, Marvin, would learn that she would also be a medical advocate for her widowed friend, Joyce. And what's even bigger than this heartbreaking story is that David is just one member of a larger, invisible workforce. In 2025, AARP and the National Alliance of Caregiving published a study that estimates that 1 in 4 adults provide unpaid caregiving services for a loved one today. Their average age is 49. 61% are female, and 7 of 10 are still working full-time jobs while delivering caregiving services. These are humans juggling aging parents, raising children, mid-career stressors, living maybe with a life partner, and oh, by the way, doing all of this under the joy of menopause. Now, to be frank, we don't know how many Davids there are. Our data are samples. They get extrapolated. What we do know, and what the data consistently shows us, is that when caregiving is left unsupported and it's intense, mortality and comorbidity risks rise, especially in our older spousal caregivers. This isn't a personal failure. This is a system failure. Now, I had a calling to become a nurse, but the truth is, most caregivers, they find themselves in this job as a result of a phone call, a fall, a fracture, a stroke, an oh crap moment that separates your life into before and after. And when caregivers go at it alone and they struggle, we call that caregiver stress. And when the meds are wrong and appointments get missed and the bills aren't paid, we call that noncompliance. But this isn't a character flaw. This is what it looks like when the system shows up too late or not at all. And we need a system that recognizes caregiver strain from the very beginning. So here's a big idea. What if we gave caregiving a primary diagnosis code? Caregiving named as an actual condition with treatments, standards of care, quality measurement, and yes, reimbursement from your health plan. A code that unlocks the door to the healthcare system for caregiving. So the very moment someone steps into that role, the system would respond with a social worker who connects you to resources, education, home health aides, and mental health services. A nurse who teaches you that clinical information you suddenly need to know. And a case manager who brokers that phone call between you, your siblings, your extended family, so care can be coordinated and no one of you takes that burden on alone. We already have the system. We have diagnosis codes. All we need to do is to add more codes, and caregiving codes that would reflect the stage and the situation, like early stage caregiver dementia, or mid-stage caregiver stroke. 4 small words that would result in systemic change. What would David's life have looked like if that system had been in place? What might yours? Now, the system isn't there yet, and until it catches up, there's 3 things every caregiver should know today to protect yourself inside this system. Number 1, name your role and say it out loud. I'm a caregiver. Say it to yourself, say it to your partner, say it to your employer, and say it to your physician. When a role goes unnamed, it goes unsupported. So come on, even if you aren't one, join me in saying, I'm a caregiver. I'm a caregiver. Number 2, get that in writing. Get your name into the medical record as caregiver. Have access to the HIPAA form. Make sure your name is there. Make sure that you have the advance directive, or if you are the agent, you have a copy. Know the password to the electronic health record, so you have easy access to looking at medications, lab values, upcoming appointments. And most importantly, you can easily communicate with other providers of care. Doing caregiving requires access to clinical information. And number 3, protect your health. Define your non-negotiables. What recharges you? Maybe you need 6 hours of sleep. Maybe you need an hour for a walk or 30 minutes for meditation. Or my personal favorite habit, mini moments of movement to really reduce the stress. Whatever it is that you need, make sure that the plan you agree to has your needs in it every single day. Now, for the rest of you in this room, you may not be a caregiver today. But statistically speaking, you will either be a caregiver or a care receiver. So I've got a few steps for you too. I want you to see the caregivers. If you know someone caring for a loved one, I want you to see them. Ask how they're doing in addition to the person they're caring for. And if you want to offer help, I'll teach you a way to do that. It looks like this. Would it be helpful to you if I? That's the structure. You fill in the blank. You know your friends best. Would it be helpful to you if I brought over Sunday's dinner? Would it be helpful to you if I sat with your mother Saturday afternoon? Offer an act of service that you know you can deliver. Next, I want you to use your voices. Join conversations on caregiving. Start one with me today. Talk to your employer about caregiver benefits. Talk to your neighbors, your elected officials, people in healthcare policy. It's going to take a cacophony of voices to make this change, and your voice really matters there. And for any of you who work in healthcare, at every bedside, at every care conference, at every follow-up visit, I want you to ask yourself two questions. Who is caring for your patient? And how are they doing in their caregiver journey? Take a look to your right. Take a look to your left. The estimates are 1 in 4. And if we extrapolate that estimate, we have 63 million caregivers in the United States holding the system together, unnamed, uncoded, unsupported. Caregivers who become visible to that system only when they're sick and stressed with illness and disease. Now imagine this. Those caregivers, like David, they go to an appointment with their doctor or nurse practitioner. And they review Joyce's needs. They talk about how she's doing. They make medication change. And then the physician turns to the documented caregiver in the record and says, David, how are you doing? Let's talk about your caregiving plan. Until we close this gap, we will continue to pay higher healthcare costs, have poor quality outcomes, and we'll see the unnecessary loss of lives of people like David. It's time. It's time we named caregiving. It's time we gave caregiving a primary diagnosis code. And it is finally time that we open the door to healthcare for caregivers, not just for David, for all of us. Thank you.